Hi, good evening. Today I'm going to talk about a phone call which I received from a friend of mine, formerly a student. It's about a 32-year-old woman who delivered for the first time by a forceps about 2 months ago. It was an uneventful delivery and she was discharged without anything serious from the hospital after 3 days. But she's been bleeding on and off ever since she delivered. Variable quantities. Some days it's very light like a streak, and on some days she passes large clots. The examination was normal. The uterus was non-tender. It was a bit bulky, but nothing else which was noticeably wrong. The ultrasound showed a 2 by 3 centimeter echogenic area in the lower segment of the uterus or the upper cervical canal. So the question now was, why is she bleeding and what do we do further? So of course one assesses the stability and the hemodynamic condition, ensures that she is all right in that sense, and then considers the possibilities. The most likely reason why she is bleeding is that she may have some retained products which have gotten organized and look like a small clump inside the uterus. But one also should consider the possibility of a gestational trophoblastic neoplasm, an arteriovenous malformation or an AVM, and a polyp, though unusual for it to just arise de novo. So the next set of investigations that we talked about was that she will undergo a beta HCG and a color Doppler examination, which came in after a few hours, and the beta HCG was 1.2, essentially negative, and the mass on color Doppler showed some minimal vascularity. So considering these investigations, we kind of rule out a gestational trophoblastic neoplasm and an arteriovenous malformation. We are left with the possibilities of retained products of conception and a polyp. Now, the best way to deal with this situation is to go ahead and do a hysteroscopy and be prepared to resect whatever one sees at that point. One word of caution though, sometimes the postpartum uterus can be quite vascular, even though the color Doppler says that the vascularity is just above normal. It can bleed when the resection is done. So in such a situation, one should be mentally prepared to do an intrauterine tamponade with a pediatric Foley's catheter. I hope this was useful in terms of dealing with secondary postpartum hemorrhage. Thanks.